What do you think are some of the most common misconceptions you hear about breast cancer?
What I think the most common misconception I see is that my patients compare themselves to someone else that they know. And often that person's cancer is very different from their own. Treatments have changed dramatically. And so I encourage people to kind of go into it with an open mind, because things are probably not the same as they were for their friends or other people in their family who may have been diagnosed with breast cancer at some point.
What is one piece of advice you would give someone who just received a breast cancer diagnosis?
You can really bury yourself in the internet with all the information that's out there. It can be very scary and overwhelming. So I would encourage women to recognize that each case is individual, to seek out a provider with expertise and who specializes in breast cancer, both from a medical oncology and a surgical perspective. Much of what's out there on the internet and so forth is not relevant. The second part I would encourage is involvement in patient support groups. I think once you know what you have and what your treatment plan looks like, that's probably the best time to, find other women out there who can help talk to you about their journey and their experience. Because again, it really depends on some of those details. And then to rely on the support services that you have within your family, the things that you like to do. I mean, we live in New Mexico. It's a wonderful place to hike and do things outdoors. Do those things to take care of yourself as you go into this journey.